With the government defining what is acceptable coverage, a qualified plan, we are very concerned that this will drive health insurance costs higher for many small businesses. An acceptable benefits plan will likely include new mandated services and other provisions not included in some firms' current plans, which means costs will increase. We are also very concerned about the overall regulatory compliance costs in the bill. You cannot read this bill, H.R. 3200, and not acknowledge that it is a regulatory monster. Complying with H.R. 3200 will be complex and costly. The federal government will develop a system to track whether businesses are providing insurance, making their minimum contributions to employees' coverage, as well as the proper proportion amount for non-full-time employees, filing annual reports for each employee, paying the correct penalty tax in the exchange if you don't offer insurance, and the list goes on and on and on. None of this is going to lower costs for business. And as we know, the cost of regulation falls disproportionately, is more burdensome for small business. Small business owners desperately want reform. They need reform. They've been leading the parade for reform for many years. But it has to be small business friendly. It has to lower costs. It has to produce reasonably priced coverage and more choices of plans for small business owners and their employees. It's small business owners who have led us out of previous recessions. They can lead us out of this current recession, but that will not happen if they are encumbered with costly new mandates, high taxes, regulations, and penalties. And unfortunately, that is the direction of the legislation that is moving through the House as we speak, and it certainly is not a plan that small business owners can afford. Thank you.
Thank you, Karen. Now, what I'd like to do, I think we can go until 2 o'clock, and what we'll do is give each member 5 minutes to ask questions. We'll kind of watch that clock since we don't have a clock in front of us. I may tap the gavel if I need to, but we'll try to do this in the order that the members came to the hearing. Mr. Klein, Mr. Ryan, Mr. Herger, Mr. Camp, Ms. Brownwaite, Mr. Johnson, Mr. Shattuck, Ms. Jenkins, Mr. Cassidy, and if there's any time or questions left, I'll be last. So, Mr. Klein, do you want to start?
Thank you, Mr. Chairman. I think the microphone is actually working. I want to thank the witnesses. You've just been absolutely tremendous. I'm from Minnesota. So, of course, Canada is neighboring. And we, of course, see anecdotal evidence all the time of Canadians coming to Minnesota because we actually have a Mayo Clinic there, too. I'm not sure why you travel all the way to Arizona, Ms. Schoen. Okay, that's all right. But we have a Mayo Clinic in Rochester, Minnesota that is world famous. And you chose to come to a Mayo Clinic. You could have chosen, frankly, to come to several hospitals in Minnesota or other states. And Mr. Baker has given us examples of hospitals around the country where Canadians have gone. You did that because you needed to, you had to, and you could. You could do it. I think that the phrase that I think it was Mr. Baker said that the U.S. is the Canadian system of last resort. It's a place you can go. And so I'll start with you, Ms. Robertson Holmes, if I could. If the United States were to adopt a system like Canada has, with a government-run health plan that operates like that, do you think that the Mayo Clinic in Rochester and other would still be able to provide services for you and other Canadians?
Well, I'm not sure that that would continue to happen. I think that it would. I don't see where the need would be on either side. And what I think is that if Americans then needed a place to run, if your facilities are now completely bogged down and backed up and mirror the system at which we have, would Canadians be able to then turn around and be able to help Americans that couldn't get any help? And I think that we would become neighbors with the same problem and no solutions.
Thank you. I'm not sure how the microphone switching back and forth is going to work, but I think this one is working again now. Mr. Baker, you did leave us with some thoughtful and terrifying quotes. The the quote of the doctor to Lynn of, quote, "You have not yet suffered long enough." I wonder how one determines when one has suffered long enough. And, of course, we, I think, are very much afraid that if you have a bureaucracy that's making that determination, that you will have many people suffering for a very, very long time. Let me move very quickly. Again, Mr. Baker, you're providing a service. You're entrepreneurial. You've got a program here. You've seen a need. And Canadians are actually being referred to you by concerned physicians that say, I've got to get help for my patient.
That's correct.
And so you're providing a service. And I've heard, as we're trying to catch up on what the Canadian system does, that the Canadian government may actually try to create something that would compete with your services. Is
well,
right?
If they did create something, I've said many times that I feel blessed in operating my business that my major competitor is the government. Because who cannot succeed in business if their only competitor is the government? And listen, my competitor offers the same product that I do, but they don't charge for it. It's absolutely free. I charge for my service, and yet people still come to me. What kind of an indictment is that of our system if people willingly pay for a product, a service that's free in their own?
Well, I think it's a pretty clear indictment. I just have a comment and perhaps one more question so we can move on. I've got a lot of colleagues that are waiting here. We've seen clearly when we were marking up the legislation and education and labor and talking to our colleagues and talking to businesses back in Minnesota, that the small businesses, the small business owners and employees there and those who have started to look at this realize that the bill payer here is going to be overwhelmingly placed in the hands of small businesses. And so, Ms. Kerrigan, you gave some very good testimony. What is it that you would say from the small business perspective? What is it small businesses really want to happen here? What do they want in the way of fixing health care?
Well, it's very obvious. They want their health insurance costs to go down, or at least to stabilize. Those who don't provide insurance, either for themselves or their employees, want access to affordable coverage. And I think there are solutions that have moved through the Congress previously and that have been proposed that will help them do that. I mean, certainly there is the pooling that has moved through the Congress previously that allows small business owners to pool as a group and leverage their numbers so that they can negotiate better prices and have more choice of plans. There is, on the tax side, there are tax credits that can be offered, I mean, both to individuals and to business owners. The tax code can be fixed for the self-employed with respect to tax parity. We can open up the health insurance market on a nationwide basis. Small business owners in some states are just locked into the insurance market in their states, and it's very, very expensive in some states, in New York and New Jersey, et cetera, where they have excessive mandates, and that is a barrier to coverage for many business owners. So certainly having a nationwide market, a true nationwide marketplace, not something run by the government, I think that makes total sense. More choice, more competition, and I just think some very simple, targeted reforms without taking over the whole system and making small business owners pay for it. So,
thank you. You sound just like a member of the Republican Healthcare Solutions Group.
Oh, okay.
Those are exactly the discussions we've been having. Thank you very much. Thank all of you. I yield back.
Mr. Ryan.
Thank you. Excuse us. These are government-run microphone systems. So, thank you for your patience. We just received a very recent analysis of H.R. 3200, which is the bill we're told we're probably voting on next week. And the analysis shows that in about 3 years, 103.9 million people will be getting their coverage through the public plan. Private insurance will decrease by 83.4 million, which is 48.4% in about 3 years. Medicaid enrollment will increase by 12.6 million people. And so that's just in a few years. So clearly, the trajectory here is squarely toward the public plan option eventually becoming the government plan monopoly. And Mr. Baker, I want to ask you a question. Is it Mr. or Dr.?
Mr.
Mr. Okay. Walk me through how it works in Canada with respect to how physicians are able to make decisions to customize treatments for their patients with respect to reimbursements and government, not just the waiting lines and the queues. I think we got a good idea of that. But the concern that we have under this system where the public option becomes the only option, we've already created this Institute of Comparative Effectiveness, which goal is explicitly to determine what care is reimbursed or is not, meaning it decides the treatments that can be given to patients. How does this work in Canada?
Well, it works in Canada in this fashion. Not only is access to medical care rationed, but access to the medications and the techniques involved in that care are rationed. Now, we'll go back to my client Shirley Healy, whom we sent to Bellingham, Washington for her blocked artery. Had she had that surgery in Canada, she would have had an arterial bypass. She was emaciated. She was debilitated. Her surgeon told her later that had she got the surgery in Canada, she likely would not have survived it. When she went to Bellingham, she had a stenting procedure, far less invasive, far safer, far easier and quicker. Why is it not offered in Canada? Because a stent, which is a little thing that looks like a Chinese finger puzzle, costs, I don't know, $1,000. It's cheaper to do the bypass procedure. So that is one way that the customized system is affected. Another excellent example is in access to drugs. There are evidently 25 pharmaceuticals which are deemed to be effective for treating cancer. Depending on which province you live in Canada, you may or may not have access to them. In British Columbia, where I'm from, we have access to 23 of the 25. Hopefully, if you come down with cancer, your particular type is receptive to treatment by one of those 23. But what if you live in Prince Edward Island, our smallest province? They only approve 1 out of the 25. You would have to be very lucky to have cancer that was treatable by that one drug. But what if you had cancer that required one of the other 24? You would be just out of luck.
Yeah, that's exactly what our concern is, which is physicians ought to be able to have the maximum amount of freedom in a free market system to customize and tailor the care per the particular need of their patient. Each patient is different. Each ailment is unique. And if we set standards by a government body, the uniqueness of that patient is completely disregarded. It's cookie-cutter, standard-based medicine.
Well,
but you're saying it's based on cost. So it's all cost-driven, not therapy-driven. It's not necessarily even best practices. What's the best way to treat stage 3 ovarian cancer? But, okay, so is it 5 minutes up already?
It is.
All right. I guess I've been gavelled. Thank you.
Let's go to Dr. Gingrey, and we'll remember, Dr. Sikora, we remember you're there, too. Dr. Gingrey?
Mic working?
I don't know. How do you get it off?
Hello?
Testing. There we are. Well, I wanted to direct my first question to the, not to the doctor, but the gentleman, Mr. Baker, who was just spoke about. You made a comment, Mr. Baker. I want to. This is not a question pertaining to this comment, but you said, who cannot succeed in business if their only competition is the government? And I think that was in reference to the fact that you weren't worried about competing with the government for your business and your business model and your plan and your entrepreneurship and how well you have done. And we commend you for that. That is the American dream, if you will, American success story. But I can tell you who would not